All right, functional friends. We are going to get started in just a moment. You guys are starting to stream into the Zoom room here, so I want to let everybody get in here, get settled. We'll get started momentarily. My name is Brendan Vermeyer. I'm on the clinical team at Microbiome Labs. And I'm very excited to have the opportunity to moderate this amazing webinar put on by my wonderful colleague, Jenny Olson, who I'll introduce. So for now, make sure you guys get settled, have some water nearby, some snacks. You guys get to kick up your feet, relax, enjoy a lot of amazing microbiome education. So now that we have plenty of attendants strolling in, it is my absolute pleasure to introduce my dear friend, Jenny Olson, who is a nationally board certified holistic nutritionist who has spent the last 12 years working in the health and wellness industry as a public health educator and nutrition therapist. She received her undergraduate degree in international relations from the University of Northern Colorado in hopes of joining the Foreign Service. But life took a turn, and instead, she went on to get her master's in nutrition therapy from the Nutritional Therapy Institute in Denver, Colorado. And she joined Microbiome Labs in 2024 as a clinical science liaison, supporting practitioner education and training. So she has a wonderful presentation for you all today. I'll be moderating the Q&A and chat box. Don't be hesitant with dropping your questions because we will have some time for live Q&A after the presentation. So for now, relax, enjoy the microbiome sciences, and we'll go ahead and get started.
Thank you so much, Brendan. I'll get going here for you guys. I have pre-recorded this for you today, but I only did this a couple days ago. It's because I have a presentation tonight, so I hope that you enjoy. Again.
Hello, friends, and thank you for being here. I'm excited to share this information with you today on an in-depth review of Candida overgrowth as part of our continuing conversation about strategies for optimizing the female microbiome. Well, the topic of Candida can be quite extensive. Today, I hope to focus on a few key areas pertaining to female health. We'll endeavor to profile Candida and its mechanisms of overgrowth and virulence, then take a look at a few key risk factors for vaginal Candida overgrowth and how this is heavily influenced by the vagina-gut immune axis, and finally, key interventions in both preventative and acute situations. Throughout our discussion today, my hope is that you'll walk away with a deeper understanding of the strong influence of the gut microbiome on vaginal health and perhaps some Candida risk factors you may not have considered before, and most importantly, practical solutions you can start applying right away with your female population. All right, so Candida overgrowth today. So if we look at research over the last 5 years, it's really shown that fungal diseases pose an increasing threat as we see the increase of antifungal resistance give way to more virulent Candida strains. And it was once thought that these infections had a low mortality. Recent studies actually pose that this may be underreported by about 5 times due to challenges in diagnosis. So within those fungal infections, nearly 90% of them are caused by only a few select species of Candida. So of all the species, actually Candida albicans is the most common, driving about 70% of fungal infections around the world. And if you've been to any of our webinars this year, you'll know that vaginal Candida infections affect up to 75% of women of childbearing age. Plus, up to 9% of those women will experience more than 3 episodes per year, which is known as recurrent vaginal candidiasis. And one of the main take-homes for today that I just want you to think about is that more and more research confirms that the gut microbiome is really the primary source of infection or the infection reservoir for these various types of Candida infections. So for purposes and for scope of today's discussion, we will be focusing on Candida albicans, which is the most common commensal fungal resident of our microbiome that colonizes the oral, gastrointestinal, genital, mucosal surfaces. and skin, and is generally asymptomatic, even in many cases aiding in nutrient digestion and absorption. And like most residents of our microbiome, Candida has this interdependent relationship with other bacteria. However, Candida also has an incredibly opportunistic nature. So when there is any impairment of mucosal barriers or a disturbance of the microbiome, such as during and after antibiotics, this can trigger the fungus to grow and migrate through the epithelium into deep-seated niches, causing infection, which can generally be classified as either mucosal or systemic. And today, we're primarily going to be discussing mucosal challenges with intestinal and vaginal candidiasis. Though, if those are left untreated or mistreated, or they go on for too long, these can become systemic, which involves a breach in the bloodstream. So, Candida overgrowth can really produce a myriad of symptoms depending on the infection site. However, as we'll discuss in later slides, the gut is really often the first site of overgrowth, and so this can come with some of our first signs of gas, bloating, bowel irregularity, indigestion, food intolerance. Sugar cravings can also be a telltale sign of Candida overgrowth. Brain fog, poor memory, headaches, fatigue. So a lot of these symptoms could actually apply to many other health conditions. So this can make diagnosis kind of challenging, but there are a few symptoms that seem to be more strongly tied with fungal overgrowth, like sugar cravings. Recent research also shows that fatigue may be more highly associated with Candida. Vaginal discomfort, of course, like itching and discharge, as well as sinus infections. So all of these seem to be associated with Candida overgrowth. So let's talk about who Candida is and how did specifically Candida albicans become the most common cause of fungal infections. This is largely due to what's called morphological plasticity. If Candida albicans were to have a resume, I might imagine that this slide is kind of a truncated version, where on the top we see it boasting about being the most successful of all the fungi, always seeking out opportunities to expand, very dynamic, adaptable, and flexible. So it kind of reads like a resume. It can take on different morphological forms, such as they're pictured here. So we have its yeast form, a pseudohyphae form, and full hyphae form. This is a unique capability to switch forms. It allows it to exist as a commensal until, of course, opportunity strikes. Then it begins its transformation from yeast to hyphal forms, or from colonization to invasion. Candida can adapt to different Candida can adapt to different temperatures. It can acquire surrounding available nutrients, adhere and invade mucosal surfaces, evades immune detection. This is through biofilm. And in a lot of instances, it's going to gain tolerance to certain antifungals. So this is where we see antifungal resistance. And this invasion really is made possible through particular virulence factors, such as the secretion of protease enzymes like candalysin and secretory aspartyl protease, and adhesion sequencing. So these are all involved in tissue invasion through adhesion and the degradation of structural epithelial cells. So this is its ability to, it can build strong biofilms in order to evade immune detection. So let's take a look at the progression from colonization to invasion. So you see on the left side in our healthy state, so healthy state versus dysbiotic state. This is something we're accustomed to seeing sometimes depending on what we're trying to depict. So in that healthy state on the left, yeast cells are balanced by other commensal bacteria and are not doing any epithelial damage or inducing excessive immune response. In this state, antimicrobial peptides, secretory IgA, the mucus layer are all helping to control yeast and prevent that translocation. Then we experience a triggering event, which really can be a number of things that we'll talk about, but a primary trigger would be something like antibiotics, which remove competitive beneficial bacteria like lactobacillus, thus allowing the candida to proliferate and activate its morphological transition into that hyphal form. And in this state, they begin to secrete virulence factors like candilicin, SAP, this is the secretory aspartyl-protease, and this allows the candida to adhere to, damage, and penetrate the intestinal epithelium. This will lead to that activation of a series of immune signaling from NLRP3 inflammasome, which is more distinctive in vulvovaginal candidiasis. It activates NF-kappa B, Th17 dysregulation, reactive oxygen species, and not to mention the conversion into acetaldehyde, which can disrupt our glucose signaling. And then if there's really a failure to reduce or resolve the immune response, this then can lead to the symptomatic infections like oral, vaginal, intestinal candidiasis. Now, a really big part of this morphological transition is the formation of biofilms. We can't talk about Candida without talking about biofilms. And most infections caused by Candida albicans are caused by the creation of biofilms on the surface of the host or abiotic surfaces like implants, surgical implants, leading to a high morbidity or mortality. So it goes through this phase where we have an attachment of yeast cells to the surface, and then phase 2 is cell proliferation and filamentation. So this is the forming of elongated protrusion or hyphal forms. And then phase 3 is that accumulation of extracellular polysaccharide matrix to form that biofilm. The final phase is the dispersion of the leftover yeast cells to a new site or to further spread into the tissues. So when we're thinking about these mechanisms, one thing that we want to be thinking about is what causes that morphological transition from yeast to hyphal form, as well as what produces high biofilms, as this is going to help clue us into what to watch out for with our patients. Poor nutrition is, of course, a big factor that can lead to dysbiosis, low immune function, provide added fuel source for Candida in the form of sugar. And whenever the microbiome undergoes dramatic shifts, either from antibiotics, pathogens, this is going to provide ample opportunity for Candida to multiply. There is a high prevalence of Candida overgrowth in those with inflammatory bowel conditions like IBS and Crohn's, and even medications like PPIs are also highly associated with fungal overgrowth. And whenever we have anything that suppresses the immune system, so either from serious conditions like HIV or just medications like corticosteroids, or periods of chronic stress, diabetes is also known to suppress immune function. This will lead to higher blood sugar and increase our Candida risk. The overuse of antifungal drugs can also backfire and increase biofilm production. And lastly, hormonal fluctuations like estrogen are strongly associated with increased vaginal yeast infections. So now we've discussed some of the mechanisms for Candida invasion, as well as what types of things might trigger these infections. So now let's turn to how this plays out in the female microbiome, specifically the role that the vagina-gut axis plays in vaginal Candida overgrowth. When we look at the risk factors for vulvovaginal candidiasis, they are going to be similar to our list of what triggers Candida to go from friend to foe. So we see this convergence of factors that come together causing this infection, from the nature of Candida itself, aka its resume, to host immune factors, and then the environment, which covers vaginal and gut dysbiosis, and hormonal influence. So we're going to take a closer look at a few of these areas, starting with vaginal dysbiosis, then gut dysbiosis, and finally the influence of estrogen. So to help get us oriented, let's review some of the characteristics of an optimal vaginal microbiome. First of which is the presence of a high abundance of lactobacillus species. This offers key protection like lowering pH, producing lactic acid, producing bacteriocin compounds that help us inhibit pathogens. And unlike our super complex gut microbiome, there's a bit of a paradigm shift for the vaginal microbiome, with low diversity being the ideal state. And we want ideally a pH between 4 and 4.5. Those lactobacillus species that seem to dominate are Lactobacillus crispatus, Gasseri, Jensenii, and L. einers, which still has some question marks in the research as it can be associated with both healthy and dysbiotic states. However, as we'll see, this seems to be highly associated with vulvovaginal candidiasis. So using those lactobacillus species, this is actually how we can classify the vaginal microbiome. So if you've been with us this year, you'll be somewhat familiar with these, but if not, let's go through them together. There are 5 different groups, 4 of which are dominated by lactobacillus species. State type 1 is considered the healthiest, dominated by L. crispatus and associated with a higher resistance to dysbiosis through its ability to produce D-lactic acid, which keeps that pH nice and low and remains relatively stable throughout the menstrual cycle. State type 2 is Lactobacillus gasseri dominant, not as common, but still considered protective. State type 3 is L. einers dominant, and this type can be kind of a wild card as it is associated with both healthy and dysbiotic outcomes, and it's speculated that one reason for this is because L. einers produces L-lactic acid as opposed to D-lactic acid, which, as mentioned, is more resistant to dysbiosis than the L form. Type 3 is considered to have a higher potential for transitioning to bacterial vaginosis, or BV, as well as it being more likely to harbor candida. Now, moving on to state type 4, this is characterized by either low or no lactobacillus, seems to have a higher pH and a higher risk for BV, and is also found to induce more pro-inflammatory signaling and has strong associations with sexually transmitted infection, endometriosis, miscarriage, so it's one we want to avoid. And state type 5 is dominated by Lactobacillus jensenii. While less common, is still considered healthy. So we're really trying to aim for community state types 1, 2, and 5. So in recent years, there is been more research emerging revealing some nuances to these community state types, which is really exciting actually. And in this paper from 2023, specifically looking at the relationship between these state types and Candida albicans, we see that even in the context of Candida, we're still aiming for community state types 1, 2, and 5, as it's shown that these lactobacillus species, especially Lactobacillus crispatus, compete with Candida for adhesion, help reduce biofilm formation, and produce important antimicrobial compounds like D-lactic acid and hydrogen peroxide, which seems to have strong antifungal properties. The low pH associated with these state types is also thought to inhibit the transition from commensal yeast cells to that more virulent hyphal form. Conversely, L. einers dominant community state type 3 is the least protective against Candida, as L. einers does not produce D-lactic acid, but instead actually produces a cytotoxic compound like ineroleucin that has been shown to damage vaginal epithelial cells. L. einers was also found to actually enhance biofilm formation, which increases its risk for developing recurrent Candida infections. While it's really great to know these details about the vaginal community state types, we also really want to understand what causes these microbial changes. And if you recall our discussion about gut-vaginal crosstalk, this should not come as a surprise that the gut is the primary source of influence. And this connection is clearly observed when we see interventions like diet and oral probiotics that we know are altering the gut microbiome also seem to help reduce vaginal dysbiosis, and vice versa. For instance, women with irritable bowel syndrome show a higher risk for vaginal candida overgrowth. And there are a few proposed mechanisms here, but it is thought that the primary driver is the very close proximity of the vagina to the rectum. This is a direct route for bacterial translocation, and we see that the presence of BV-associated bacteria in the stool has a higher incidence of bacterial vaginosis, and alternatively, when we have a higher abundance of L. crispatus in the stool, there's a higher likelihood of vaginal health. And in this sense, gut health can confer vaginal health. And this physical proximity isn't the only mechanism. Now, as messy as this graphic appears, I do find it kind of exciting that it depicts these different mechanisms of influence, proposed influence between the gut and the vagina, indicating some of the dynamic opportunities that we may have to build vaginal health. And while the direct microbial influence, the well, the direct microbial translocation between the vagina and the rectum is still really the most well established. So the solid lines indicate that this is a well established relationship, where the dotted lines is not quite as researched. So, more to come. But so we also see some other avenues of influence, including the immune signaling from the gut to the vagina influencing immunoglobulins like IgG and IgA, which in turn can impact the stability of our lactobacillus species. Our estrobolome, which many of you are familiar with, influences circulating estrogen, which is going to impact glycogen and lactobacillus levels. Then we have metabolites and components from our gut which either hurt or help. So whether it's generating more lipopolysaccharide into circulation or anti-inflammatory cytokines through short-chain fatty acid production. To further support this connection, there has been research showing that vaginal candidiasis stems from intestinal candida overgrowth, and that addressing the gut microbiome is the primary strategy for preventing reoccurrence. This hypothesis was explored as far back as 1977, actually. In a study, this showed that if Candida albicans were cultured from the vagina, they were always found in the stool. Conversely, if it was not isolated in the stool, then it was not found in the vagina. Again, this was an older study, it was a smaller study, so a more recent study investigating this relationship using whole genome sequencing first found that Candida albicans was the dominant pathogen in vulvovaginal candidiasis cases, and that it was only 33% of the patients with vaginal candida were infected in both the vagina and the gut. And of those, 92% had a really high homology. Now, what was interesting here was that the reoccurrence rate for vaginal infection was higher in those that had an infection in both places. So this re-emphasizes the need to address the gut microbiome, especially in challenging, recurrent, persistent cases. So in addition to the gut microbiome and the vaginal microbiome and the axis between the two, hormones have also been shown to play a role in the development of vaginal candidiasis, specifically estrogen. So we know that higher levels of circulating estrogen affect candida colonization, and there's a few proposed mechanisms for this, such as estrogen may increase the ability of candida to adhere to the vaginal epithelium, as well as potentially downregulating neutrophils, thus reducing the immune system's capacity to kill candida. There's also some research showing estrogen might promote that morphological transition and enhance antifungal drug resistance. And if we take a look back at our hormone concentration over a woman's lifetime, and also consider times when hormones may be shifting dramatically, we can identify high estrogenic states when women may be more susceptible to candida. For instance, candida colonization is higher during reproductive years, especially during pregnancy. Postmenopausal women are 60% less likely to develop candida overgrowth unless they're taking hormone replacement therapy, in which case Hormone replacement therapy, along with oral contraceptives, may increase the susceptibility of Candida overgrowth. And something I think is really important to remember here and is also noted in this research is that estrogen itself is not shown to be a direct initiator or trigger for Candida invasion. Rather, it's a strong contributing factor among other risk factors that when they're taken all together cause this infection. So knowing these points of vulnerability help us provide better preventative and proactive treatment plans for our female patients. For instance, rather than avoiding providing hormone replacement therapy or oral contraception due to persistent yeast infections, we may just want to evaluate and treat Candida prior to these therapies, which can often improve their outcomes. Or be sure to address any Candida overgrowth during preconception planning, provide safe support through probiotics during pregnancy, and other times that we can be on the lookout are also in postpartum support when there is a high risk of yeast infection, and when there's both vaginal and gut dysbiosis, also periods of high stress that weaken our immune response. And we also want to consider times during pre and perimenopause when there may be dramatic fluctuations of estrogen levels. So all of these areas are things to think about and be on the lookout for our female patients. And in addition to the symptom profile and as well as some of these high-risk seasons, we can also look to the Biome Effects stool and vaginal kits where we can look for patterns like low alpha diversity, detectable Ascomycota phylum, and our elevated hydrogen sulfide producers. So this is in our proteolytic fermentation section. And just our obvious Candida pathogen detection, poor pathogen control, along with possibly a detection of C. diff and H. pylori. And then we can also look to the vaginal microbiome patterns like community state type 3 or 4, as well as the detection of Candida or ureaplasma. So now that we've discussed some of the research and the scope of Candida and some of the risk factors for females, what should we be thinking about when we're building an effective plan? And some of the things we want to look for, especially when considering the mechanisms for Candida, we want the inclusion of restorative and competitive probiotics. We need a natural antifungal component that doesn't cause resistance. And we also want to include that biofilm support, as well as supporting the integrity and resilience of the gut barrier, and be sure that pathogen debris is cleared when it's dying off. So one of the first areas we'll consider here for interventions are oral probiotics, which have received a lot more attention in research over the last 10 years. Really, the research showing how they benefit the vaginal environment from benefiting the vaginal microbiome balance, vaginal discomfort, yeast overgrowth. So we'll go through a few of these studies today. So let us start with Astarte. This is a unique blend of 4 lactobacillus strains. This is Lactobacillus crispatus, Jensenii, Gasseri, and Lactobacillus rhamnosus, which are all important for maintaining a healthy vaginal ecosystem. These are isolated from healthy pregnant women, and they're resilient to digestion as they're both bile and acid resistant. They also contain a novel enzyme that moderates the pH environment as they go through the GI tract. So this allows for that bile and acid resistance. This blend has been studied in several different trials, but for today we'll focus on one pertaining to Candida outcomes. So here, let's first take a look at this in vitro study. This analyzed 4 strains and how they affected Candida strains as well as Gardnerella vaginalis. And you can see that in addition to the impressive response of Gardnerella, they also had a pronounced impact on inhibiting the growth of Candida albicans and other Candida strains. So while they have varying levels of impact, when they're all taken together, they're going to confer a strong and unified effect on these Candida strains. So in this study from 2016 from Anna Sheena, this was an open randomized controlled trial evaluating the effect of Astartate, the Astartate blend, on Candida outcomes in pregnant women. So these pregnant women, they were both healthy and with herpes. So herpes was the model for vaginal dysbiosis. So some of the women received a prenatal standard of care, some received just the Astartate blend, and some just the control with no intervention. So here they were looking at outcomes like candida presence, vaginal discomfort, but then they also looked at other pathogens like E. coli, Enterobacter, Klebsiella, Gardnerella, as well as some other pregnancy markers. And what was shown and what they found here was that Astartate significantly reduced the percentage of women with the presence of candida by 50%. Additionally, Astartate led to a significant 66% reduction in the number of women complaining of vaginal discomfort. And in addition to those results, they also found there was a 200% increase in lactobacillus colonization, which led to a 50% decrease in women who had pH over 4.5, coming from that lactic acid from lactobacillus, and also an increase in hydrogen peroxide production. Again, that's that antifungal agent, which is really important for fighting candida. Also, a significant decrease in vaginal itching, decreased pathogens, and significant reductions in placental insufficiency and preeclampsia. Next, we'll take a look at LA5 or acidophilus, which has been studied more specifically for candida, whereas the Astartate blend is geared more towards overall vaginal balance. And this was a year-long crossover study with 6-month intervention periods that assessed the effect of LA5 on women with recurrent vulvovaginal candida infections. And here they were measuring both candida presence as well as infection recurrence. And what they found was significant, with significant decreases in infection and reoccurrence. Those that were taking LE5 saw a decrease in 85% reduction in infection, as well as a 74% reduction in AMSL score or candida colonization over that 6-month period. And a fun fact, in case you missed it in Alicia's webinar that she mentioned, is that the original cohort of this study was larger, but about 40% of those women who were taking the LA5 actually refused to stop taking it and cross over to the placebo arm because they were feeling so good. And here we have a triple-blinded randomized control study published in 2023. This was comparing the effects of LA5 to standard of care fluconazole on vulvovaginal candidiasis. One group was receiving the probiotic plus a placebo, and the other group received a probiotic placebo and fluconazole. So the outcomes that they measured here included candida overgrowth, itching, discharge, burning, and dysuria. And in addition to really improving a lot of the vaginal discomfort markers, they also found there wasn't a statistically significant difference between the probiotic and fluconazole group for candida overgrowth. So we see that the LA5 group saw a significant reduction of discharge, 30% reduction of discharge, 66% reduction in burning, 58% reduction of itching, and then 57% reduction of dysuria, or this is altered urination. Now, pivoting slightly and turning from our lactobacillus friends, I just want to highlight a few other probiotics that are important to consider when addressing candida, especially when induced by antibiotics. And as mentioned before, antibiotics are one of the primary drivers of microbial dysbiosis and precursors for recurrent candida infections. We know they're necessary in many cases, but we just want to be aware of some of their impacts. So in this SHIME model study, combining Bacillus subtilis HE58 and Bacillus coagulans SC208, together they produced several positive outcomes where 1 week of antibiotics was administered and at the same time 2 weeks of this spore combination. And the results first showed that the spores are antibiotic resistant, so they can be taken during that course of antibiotics. Then we saw that there were improvements in gut barrier and immune function, as well as a decrease in TNF-alpha. So these are all important benefits for both antibiotic recovery as well as Candida protocols. So another important probiotic to consider for Candida is a different commensal yeast known as Saccharomyces boulardii. So Saccharomyces boulardii has a multitude of benefits in general, but specifically can secrete capric acid, which decreases Candida albicans virulence factors such as hyphae formation, adhesion, and biofilm development. Saccharomyces boulardii can also help reestablish that normal microbiome and short chain fatty acids, which are also going to help reduce mucosal inflammation. So this is really important when it comes to Candida, as Candida can do a lot of damage at the epithelial site. And it's helpful to remember that these lactobacillus species are some of the first bacteria that get wiped out during antibiotic therapy. And when this happens, this creates an opportunity for Candida adhesion and overgrowth. But when we can apply probiotic therapy, as we just saw, this is going to help inhibit that fungal overgrowth and help restore gut barrier function. So now that we've established some of our probiotic foundations, let's start layering in more targeted therapeutics for Candida. So let's talk about undecilinic acid. This is not only fun to say, this is a powerful fatty acid derived from castor bean oil. And it's really important for inhibiting and breaking down biofilms. And biofilms can increase antifungal resistance. They're going to protect the Candida from the immune system. So disrupting this biofilm is a really important part of any Candida protocol. And undecilinic acid has been shown to do just that. Here you see the results of a study with Candida albicans and undecilinic acid, where the yeast cells were incubated with acid for 3 hours. The cells were examined to determine the percentage of yeast cells that had gone through that morphological transition to hyphae form. And remember that morphological transition is really important for its virulence. So the results showed that the percentage of hyphae formation dropped to 0 within that first hour. So this is showing that undecilinic acid can inhibit the morphogenesis of Candida albicans. Next, we have bee propolis. It may not be the first therapeutic that comes to mind when we're thinking about Candida, but bee propolis is a mighty and pleiotropic ingredient. This has been shown to break down fungal cell walls. Propolis has a wide spectrum of biological activity such as antibacterial, antifungal, antiviral, antiparasitic, anti-inflammatory, immunomodulatory, antioxidant. So as you can see, it is widespread. The compounds responsible for this biological activity of propolis are thought to be things like flavonoids, caffeic acid, esters, phenolic compounds, aromatic acid, and esters. So again, it has been shown to help break down some of the cell walls in Candida. Also, it has been shown to be effective against fluconazole-resistant Candida strains. So what happens when we start to shift the microbiome? We're breaking down biofilms and cell walls. Well, this produces cellular debris or die-off, otherwise known as the Herxheimer effect, which many of us are very familiar with if ever we're running detox or Candida protocols. And this can cause some of the same symptoms of the infection. Um, Sometimes it is actually a little bit more intense. And when this happens, we often may stop treatment. We are going to start again. We might go low and slow, implementing lymphatic drainage strategies like dry brushing, lymphatic massage, sinus rinsing. We're going to be managing stress and inflammation with Epsom salt baths, saunas. We're protecting our sleep. But we also want to make sure that we're binding these toxic byproducts up to ensure that they're eliminated from the body, which is why we want to look at serum bovine immunoglobulin or IgG. Here you can see that IgG can bind to Candida albicans in addition to several other compounds including aflatoxin, LPS, especially Klebsiella. So these can often co-occur with a Candida infection. And by neutralizing these substances, IgG may help to mitigate some of this die-off response and subsequent inflammation. And remember, Candida can wreak havoc on the mucosal and epithelial lining, so we want to reduce gut permeability and maintain GI immune balance while also improving nutrient and fluid absorption and utilization. So that's also why we see this ingredient in a lot of our Candida protocols. And then here we see just the progression and some of the actions that IgG is taking at the gut barrier. So by binding to those microbial components, reducing antigen uptake, we're improving that nutrient utilization, which is really going to help manage gut barrier function and improve tight junction protein expression. So all of these, again, very important when addressing Candida. So now you can see how this all comes together and culminates within the products here. So we have our vaginal balance that contains our lactobacillus species. So this is really going to help us fight and crowd out our candida, optimize our pH and reduce vaginal discomforts. Then we have our mega mycobalance. So in mega mycobalance, we have that undecylinic acid and B propolis, otherwise known as the 1-2 punch. And this is really going to help slow that formation of hyphae and regulate candida potential virulence. Mega IgG 2000 is going to be a really important component. This is containing serum-derived immunoglobulins, and this is going to bind to those endo and exotoxins, including Candida albicans. And then we have our Restore Flora. So this contains our Saccharomyces boulardii and Bacillus spores that are going to help balance yeast as well as reducing GI symptoms like gas, bloating, abdominal pain, and reducing inflammation at that gut barrier. So how do these all come together in a protocol? And depending on if we're experiencing acute or chronic symptoms, this is how you would start with our vaginal balance, mega mycobalance, and mega IgG. So vaginal balance is 2 capsules per day. Mega mycobalance is 1 soft gel per day, and then you're working up every few days, adding 1 soft gel until you get to 6 soft gels. And then mega IgG is 2 capsules per day. And you can see that on week 2, it says 2 plus. So this gives us flexibility as a patient may need to continue this protocol depending on symptom severity. And then we can also consider adding in the Restore Flora. So this will be a wonderful add-on, especially in the case of antibiotic or antimicrobial use. And you can use this alongside the vaginal balance, mega mycobalance, mega IgG, and especially just remember that Saccharomyces boulardii can decrease the Candida albicans virulence factors. So this may be, especially if we're not responding to just those 3 products, we may want to add this on for an extra benefit. Now, in order to ensure that we maintain a healthy gut and vaginal environment, we may want to consider both continuing that vaginal balance, plus following this up with a total gut restoration protocol to reestablish a healthy balance of commensal bacteria, and reinforcing and rebuilding that mucosal barrier, really in order to decrease the chances of recurring future infections. So to really summarize a lot of what we've discussed today, we want to consider some of these unique female factors and when she's going to be more vulnerable to Candida overgrowth. The effective treatment and management of Candida really is going to include both vaginal and gut interventions. The vaginal microbiome really is influenced by a lot of these factors, including gut health, immune health, hormone status. So those are all going to play a role in increasing risk for vulvovaginal candidiasis. And then any successful Candida intervention will include a probiotic foundation, an antifungal, biofilm disruptors, and binding and immune support. And I thank you so much for your attention today and being part of our microbiome family and serving your patients so well. We'd so love your feedback by just using this QR code to help us better refine our future education offerings for you. And with this, I'll also include the slide deck and references and also some bonus slides.
Thank you so much, everyone. And I see a lot of your wonderful questions coming in. So hopefully we've had a chance to answer some of these. All right. And just want to make sure, Brendan, you heard everything all right?
Yeah, it was a wonderful
Perfect.
presentation, Jenny, and we
Great.
were tag teaming some of the questions. So certainly a little bit of a call for other questions if you guys want to go ahead and drop those into the Q&A. But I'll go ahead and post some of these for Jenny, and we can do a little Q&A until that dries up, and then we'll call it a day. Does that sound good, Jenny?
That sounds wonderful. Thank you.
Of course. So our friend Morgan was asking, how would you know if you have antifungal resistance? She's been taking itraconazole for a couple months and still having some symptoms. So she was looking for any insight we might have on that.
Yeah, I don't exactly know exactly how to test that. I mean, I think if you were having recurrent yeast infections and using the same treatment, it's time to pivot and find another treatment protocol. So, definitely want to consider some of these other solutions and using the probiotic approach. And I know that sometimes when we're dealing with a lot of these persistent candidal strains, there may be a need to switch and alternate some of the solutions. So if you haven't use the Mega Myco balance and you haven't used the vaginal balance, I would certainly consider trying those solutions out.
Yeah, I would agree with that. There's not really any way of knowing other than getting through the round of flucon or itraconazole in this case and seeing if the candidate overgrowth is still present or not. And certainly, too, I think part of that is to Jenny's point, we can combine some of those therapeutics of maybe combine the pharmaceutical with the Mega Mycobalance and SAC-B and the vaginal balance with the LA5. And that kind of reminds me of one of our research studies that was highlighting the LA5 or doing the head-to-head with the diflucan. So there's a lot of ways that could be overcome there. So
Yeah,
then,
absolutely. They're going to enhance that prescription treatment.
exactly. So Jenny, Morgan was also asking if you're dealing with, hypothetically, let's say, if we're dealing with Candida, but no vaginal issues. So maybe more of a gastrointestinal candidiasis. Would you change this fungal protocol at all? And how long would you take each product? For how long? Any thoughts on that?
I think it's a really great question. And, we're thinking about the versatility of some of those lactobacillus strains in vaginal balance, but then also going back and thinking about their route of transmission and some of those other mechanisms of how they're affecting systemic health. So I think, you can start with just the Mega Mycobalance, the IgG, and adding, the Restore Flora, and start with that. And you're taking that, for at least a month and titrating that Mega Mycobalance. But certainly adding the vaginal balance will only help, in my opinion. So I think that that can enhance whether or not, even if you are a man or a woman, this can help. So yeah, to answer that question, you can still use it even if you don't have vaginal symptoms.
Absolutely. So then, kind of dovetailing off that, Kevin was asking about the Mega Microbalance with what is the current advice on how long someone can take it before they should maybe switch back to the Restore Flora with the SAC-B, or when could they switch back to the Mega Microbalance? So kind of looking at how do we combine those two products or one or the other? Any insights there?
Yeah, certainly, they can all be taken together. So there is, in this particular protocol on these slides, it's suggesting to add the Restore Flora on top of taking the Mega Mycobalance. So you're actually taking them together. They're going to complement one another. So there's not a need to switch back and forth. It's more a need to add one over the other. So you're taking Mega Mycobalance, and then if you are needing to add the Restore Flora, then certainly do so. So I don't yeah, you can take them both together,
Yeah,
if that answers the
absolutely.
question.
Yeah, I think so. I think that was sufficient. So, Connie was asking about the test kits, and certainly with the whole genome sequencing, that is the gold standard technology and capturing all the genomic content within that sample. So, she was asking with the vaginal kit, obviously that'll test for the lactobacilli strains, including the L. crispatus, but does the stool test also test for L. crispatus?
Not that I'm aware of. I have not seen it. I don't know. Are you aware of if the stool test is testing for Crespitus? I don't think so.
Yeah, it doesn't report it, but my thinking would be the whole genome sequencing would capture that genomic content, assuming it's there in the sample, but the report doesn't report Lactobacillus crispatus directly. So that might be something that maybe in the future we could try to add that on to the biome effects just to have that correlate a little bit more. But either way, I think the stool test and the vaginal kit go very well hand in hand. And with the pathobiont section on the vaginal kit, those are different potential pathogens that maybe have migrated from the gut. So there's certainly a lot of crosstalk there, but that might be an interesting thing that we could bring to the research and development
Yeah.
conversations.
We also, I mean, Lactobacillus crispatus is the predominant and the healthiest strain. It's the one that we really do want to be populating and colonizing in the vaginal microbiome. There's a lot of studies behind L. crispatus specifically and lower rates of bacterial vaginosis. So certainly we want to verify that it is present and dominant in the vaginal microbiome. So again, yes, interesting in the stool, but is it making it into the vaginal microbiome?
Mhm. So this next one, we pretty much already answered. I'll just read it real quick though. So Morgan was asking if somebody could take the antifungal drugs and pharmaceuticals with these supplements. I think we've made that pretty clear that absolutely, of course, with the supervision of your healthcare provider. So then moving to the next one, Marvin was asking, what about the sinuses? Could the sinuses be a reservoir for fungal dysbiosis, Jenny?
Absolutely. Yes. We know that there can be fungal infections, mold infections that hide in the sinus cavity. And oftentimes those require additional local treatment. So yes, but you're always wanting to start with the gut. The gut is going to be the main reservoir. And we know that candida and mold go hand in hand. They can exacerbate one another. So we really need to address those gut infections first. But then, yes, I mean, whether or not you're using things like neti pots and humidifiers or essential oils, or sometimes more serious treatments. But yes, certainly you can get fungal overgrowth in the sinuses.
Absolutely. And somebody else was asking, Emily was asking about um, possible ear fungal infections as well, which, I think we've all seen kind of those horror stories of somebody having some fungus in their ears. So she was asking about the migration of candida, which, my understanding, of course, these microbes can kind of walk all over our bodies and set up shop on the skin, the ears, the sinuses, even, the lungs, when you think of like cystic fibrosis with that pulmonary aspergillosis that they experience. Now, of course, this was in the context of candida, but if you have any other insights, Jenny.
Yeah, I mean, the migration it requires that damage and breach at the epithelial lining. And a lot of times, I mean, we see that, Candida albicans can be the most prevalent, but usually, when it's going into like candidemia, so into the bloodstream, this is kind of when you're seeing some of those more systemic and really persistent and resistant infections.
So then Becky was asking, have you seen benefit from testing a client's partner for candida in a chronic case? Like, is there any, infecting your partner if you have candida, if we might want to sort of treat the whole family or treat the couple? What are your thoughts on that, Jenny?
Have seen conflicting research in this area. To be honest, I've seen some research calling for, even in some of our studies on BV, they were testing partners as well. But then alternatively, I've also seen that there's some studies that have not found a correlation between this, just because there is such a high risk factor for the bio individual. So it's a little, if we look back to that graphic on the host influence, and we're looking at, what's going on with the host's immune system. Like I said, I think this is pretty conflicting. I don't think it would hurt to test this and treat if you do find an infection. But yeah, I haven't seen really solid research there, specifically for Candida.
Yeah, and I think just clinical context matters, right? You sometimes it might be the case, other times maybe not. So Kevin was asking, he had a patient who started the vaginal balance and then had some not so great discharge for 4 days. And then the fifth day, there wasn't any discharge. So he's just wondering, is it possible that the vaginal balance was already helping to balance the microbiome that quickly?
Wow. I think that's the first time we've heard that. I mean, it's a new product, so we're hearing all sorts of new reports. I do think it can work that quickly and shift the microbiome that quickly. Um, I would also want to, in that situation, want to add the mega IgG at the very least, so that if we're seeing, potential die-off and change in discharge, making sure that we have good clearance. But yes, I think it's absolutely possible that you can shift the microbiome that quickly.
So then Marvin was also asking if is it possible if we're sloughing off the intestinal mucosa in these like large sheets, could that be a manifestation of gut infection by Candida?
So just a disruption of the mucosal layer will increase the vulnerability for that pathogen adherence. So Candida specifically will take advantage of a disrupted mucosal layer. So if we're breaching that or taking down those defenses, then that could certainly increase the risk for infection.
Mhm. And Patricia was asking, I thought this was an interesting question. Can we detect sinus candida with the biome effects?
Oh, I think it would be maybe relatively distant patterns that we might see. So looking at the Ascomycota and looking at that phyla, but I am not sure of the correlations with sinus candida. I don't think I've come across that pattern before, other than just looking for the patterns of gut candidiasis.
Yeah, directly not so much since it's not, like a nasal swab or anything like that. However, I always kind of think of like top to bottom, right? We're inhaling, so we might have the sinuses, maybe the lungs to some extent, the mouth with that sort of oral thrush, and then does it make it to the gut and set up shot in the gut, which is the biggest reservoir. So maybe not directly, maybe there's some indirect clues, right? Like maybe if they had the Ascomycota, phyla overgrowth, and then maybe also it's showing up on the vaginal kit, so you have kind of two of those spots throughout the body. So
Yeah. On that, just looking back, if you guys have the slides, so that particular paper, I'm a little bit obsessed with it. It's the female reproductive tract organ axis. So this is just, it's the bidirectional relationship between all of these areas. And there is a better connection. I mean, bladder and gut were the strongest, of course, but the oral and vaginal gut axis, the oral vagina axis, actually was pretty interesting. So I think in that sense, you certainly can make that connection.
mhm. And so then Elizabeth was asking, are any of these products effective used topically, such as maybe there's an extremely sensitive client or patient?
So I think, you would definitely want to really, if you were doing this, again, this is a very off-label use. We don't recommend it topically. I mean, it's studied to be taken and administered orally. But in these cases, most of those ingredients are not going to be problematic. The only one that I could see potentially not working out really well. Maybe the cranberry in the vaginal balance. So that may not be something that would be very helpful topically. But yeah, I would definitely, if you were to choose that, then, kind of patch test.
Yeah, it's one of those, as a company, we didn't formulate it to be used topically, so we don't recommend that. That'd be a very off-label kind of teach their own experimentation, as they were designed to be taken orally. So then one of our functional friends, who's anonymous at the moment, was asking if you recommend any specific nasal sprays for the sinuses.
Don't. I mean, I do like the ones that have xylitol. The xylitol is a wonderful kind of gentle ingredient. It's a biofilm disruptor, and I know that there's nasal sprays that use that xylitol, so that could be certainly helpful.
What's your perspective on artificial sweeteners in the gut? Does it make candida or fungal issues worse?
Um, Speaking of xylitol, well, xylitol is not artificial, but it's definitely an alternative sweetener. So I don't really know. I mean, I think that it's not a direct route. I mean, I think that this is if it's affecting the immune system, your gut microbiome, certainly this is going to cause and make way for the opportunity for candida to thrive. There's a lot of different factors that cause candida to overgrow. The diet is definitely one of them, but I would say that there's just other contributing factors like immune health, hormone health, and yeah, so I'm not familiar with pretty solid research behind that.
Yeah, no worries. So then Kevin is asking approximately how many bottles of Mega Microbalance could somebody take before maybe they need to switch up the protocols just so that we don't have any, fungal resistance that might occur.
Haven't studied that specifically. um, and I would say, if you're not if halfway through that bottle and or even at the end of that bottle, you're not seeing results or you're not seeing, improvements, this is when to switch that up. I don't know if I would recommend going through, multiple bottles before switching up. So, if that is not helping for whatever reason, considering, are we struggling to detox, adding other supports like Mega Marine? So that's, yeah, I don't know if I would, continue. Two bottles would maybe be maximum before switching up.
Sounds good. And a similar question here, but we'll go ahead and hit it. Is there a length of time you can take Mega Microbalance if somebody was on the Candida protocol and then had to take an antibiotic? Is it possible to be on the Mega Microbalance for like 6+ months?
I don't see any real issues with that. The undesolinic acid would be the only one that you might question uh, continuing for that long. So you might consider pulsing it. So taking maybe a week off and then continuing, especially if you're having to take these antibiotics and then, redo these protocols. So that's the one, you might just take like a week or two off and then continue.
Hmm. Hmm. And Regina was also asking, does all these protocol considerations, does it need to be combined with something like an antifungal diet in order to be effective, or are the supplements sort of sufficient unto themselves?
So diet is going to be a pretty major contributing factor, certainly. However, as we know in this space, there can be different versions of the anti-candida diet. And in this sense, in the years that I've been doing this diet and using it, I have definitely found that the more extreme versions uh, are not necessarily more helpful than maybe more of just an anti-inflammatory diet where it's low glycemic, we're avoiding some of our higher inflammatory foods. So I don't think we need to get overly restrictive about this, because we also want to remember the contributing factors of stress and cortisol. So those can play a role. So I do think that there's a happy medium here, but you do want to make sure that we're following a nutritious, nutrient-dense, and low glycemic diet.
Love it. All right, so that was the end of the questions, and then just a reminder there, we did put a link to where you can download the slides in the chat box, so you can snag that right now if you want. It's been posted a couple times, and then of course I'm sure the slides will be included with the recording when that goes out via email as well. So you will surely have access to the slides, the recording forever and ever. You can watch as many times as you want. And at that point, no other questions are rolling in. So Jenny, any final thoughts or words?
No, I'm so happy to be here, you guys, and just continue to do your good work with your patients.
Absolutely. Well, thank you all so much for tuning in. It was another amazing Microbiome Labs educational webinar, so we'll look forward to the next one. Thanks for being engaged and all the amazing questions. We'll look forward to serving you guys through Biome Effects consults and the clinical support line. So everybody have a wonderful rest of the day, and we'll stay tuned for the next one.